Good morning, my dear students. I am Dr. Jayaprakash K, Professor of Forensic Medicine. Let me discuss one question of INICET of November 2020 FMT. A 13-year-old girl has been brought to casualty department by her parents with an alleged history of sexual assault by a 22-year-old male. She refused for medical examination. What should be the doctor do in such situation? Okay, let me discuss on this. Number one, as per POCSO Act 2012, this is very important. All offences under this act should be informed to the police. That means any citizen of India come across any child, means any child less than 18 years of old has been sexually harassed or assaulted, it is the duty of each and every citizen of India to inform the police. At the same time, it is not only for the child. According to 357 C of CRPC, all hospitals should provide first aid or medical treatment free of cost to the victims of rape and acid attack. Not only that, see the second point that is very important, shall immediately inform the police. So information to the police is very important in case of sexual assault. And if at all you don't inform the police as per section 357C of CRPC, then you're punishable under section 166B of IPC. So not informing is a punishable act. Remember that. So all sexual assault cases have to be informed to the police. Now coming to the age and consent. Any child less than 12 years cannot give consent even for general physical examination as per 90 IPC. That means a child less than 12 years cannot give consent for any act, even for medical examination as per 90 IPC. At the same time, who should give consent in such case? In such cases, parent or guardian can give consent as per section 18(9) of IPC. But meantime, I would like to inform you that there is one exception, 92 of IPC. If a child is found to be in an emergency situation, even without the consent, if no parent is there, no guardian is there, a doctor can examine or even operate in case of emergency as per 92 of IPC. What about 12 to 18 years? 12 to 18 years, a child can give consent only for general physical examination. But remember here, it excludes per-vaginal and per-rectal examination. Only general physical examination excluding per-vaginal and per-rectal examination. That means you cannot draw blood, you cannot give any injection, you cannot take X-ray, nothing can be done, only general physical examination. And if a person crosses the age of 18 years, he can give consent for any act. Even in major surgery, a person can give consent. So that regarding consent. Later I will discuss about the question. Okay. That is as per section 87 of IPC. Now we know the law about the information to police in case of sexual assault. At the same time, now we know the law about the age and consent. Now, look here. It has come recently in the newspaper. Hospital, doctor told to pay rupees 15 lakh compensation. Let me discuss about this story. So here, this is exactly from the newspaper. not seen properly. What exactly you see here? Hospital authorities and doctors have pleaded that there are no negligence on their part. What is their defense? They said they wanted to do a proper treatment, but the family did not give any consent and shifted the patient. But what is the mistake done by the hospital? As the commission said that there are no such documentary record produced that consent was sought. What is the document? The document is informed refusal. What does it mean? One student asked me by putting this paper cutting, they asked me, sir, what should be done in such case if attendants refuse consent, shifts and then sues a doctor for not intervening? What record can prove the consent was sought? Look here, if the person does not give consent, if he say no, then you have to document it. That is known as informed refusal. It should be documented that the patient has not given consent for the procedure or examination or whatever it is. Now, coming back to the question, same question, I don't want to repeat the question. Now we see, number one, start treatment for STD and pregnancy. See, first of all, there is no consent given. Now here, in this question, it is not clear who has not given consent. Okay, she refused for medical examination, so we have to consider not only the baby, your parents are not given consent for medical examination. Once there is no consent as per the patient, means the child as well as the parents, we don't have any rights to start treatment or examination. So number one is wrong. Number two, inform the police. As I said, yes, you have to inform the police. Record refusal of consent, that is informed refusal, you have to document it. That is right. Take vaginal sample, you don't have any rights because there is no consent. Wrong. Start medical examination, no examination at all. So what is the answer at the end? The answer is 2 and 3 are true. Understood? Okay, wish you all the best, my dear students. Bye bye.